Hello, everyone. This is Betsy Wurzel, your host of Chatting with Betsy on Passion Rule Talk Radio Network, a subsidiary of Global Media Network, LLC. Our mantra is to educate, enlighten, and entertain. The views of the guest may not represent those of the host of the station. Folks, I have two public service announcements before I introduce my guest. My first announcement is September is Suicide Prevention Month. And if you are struggling and you are in crisis, please call 988, the Suicide Prevention Hotline. And if you need mental health services, referrals, please consult your primary care physician for referrals in your area. My second announcement is September is World Alzheimer's Awareness Month, and if you have any concerns about your memory, please consult your primary care physician. It is important for you to have a consult. It's okay to say, yeah, I'm having a problem. I'm having memory issues. Please consult your physician. I highly recommend that you do that. And how befitting that it is World Alzheimer's Awareness Month, and with me today is a guest, Dr. Madison, who is an experienced neurologist working with patients and caregivers facing dementia. She started a multidisciplinary center in San Francisco, California, the Ray Dolby Brain Health Center in 2014. She now works with the nonprofit Seniors at Home and has a small concierge practice. And Dr. Madison wrote her first book, Navigating Memory Loss, Essential Questions and Answers on Alzheimer's and Dementia, which will be out on October 14th, right around the corner. And Dr. Madison was also a caregiver for her mom who had dementia. And I want to welcome Dr. Madison to Chatting with Betsy. Welcome, Catherine.
Thank you so much, Betsy. It's a pleasure to be here.
You are welcome. It is my pleasure. I have found, in my own opinion, you don't mind if I call you Catherine, do you?
That's fine.
I found, in my own opinion, that people who are caregivers, even though, you're a physician, you have many experiences, but being that you were a caregiver, you know firsthand what it's like to be a caregiver. You were on the other side. You were on both sides of the fence, as I like to say. And that's really important because, when I went through the journey with my mother-in-law and my husband, the doctors, they didn't understand, except the neurologist, because his mom had Alzheimer's, so he knew what it was like to be a caregiver. But unless a physician went through that experience, they really don't know. And if I was going to buy a book about dementia, I would definitely buy a book about a doctor who experienced it personal, not just professionally, but personally. That's my opinion. So thank you for writing your book. Excuse me. And what motivated you to write your book, Catherine?
Well, as you mentioned, I did go through this myself, and oftentimes when I was speaking with families, I would say to them honestly that I knew firsthand the experience of feeling like I was working in the trenches, so to speak, and not sure if the light coming over my shoulder was from the sun or a full moon, because I didn't even know what time of day it was. So I have absolutely been there. And I stepped back from the center that I created just because it was actually consuming so much of me. There are so many people that need care, and I connect so closely with people that took a toll on me, and I decided I needed to work with people on a smaller scale. But fortunately, that center is now helping a whole lot more people. And I reflected just that over the years, as I gave people advice, there were certain questions that I would answer that would resonate and seem to make a big difference. And while many other doctors have written books about dementia who have experienced it themselves, I tried to put one together with the type of language people always appreciated in me, and that I speak in normal terms. I don't speak medical talk.
Yes.
I try to make things understandable. Right. So the book is all, I try to put it all in just understandable terms, but also very importantly, the book I'm putting out is really colored by a phenomenon that not many people talk about, and that is a condition called anosognosia. So anosognosia.
Yes, I've heard of that. Mm-hmm.
Yeah, so it's individuals' inability to see illness in themselves, and it's actually very common in dementias and Alzheimer's. It makes sense because as a dementia spreads through the brain, it interrupts the intricate networks we have which allow us to do the high-level thinking we take for granted on a day-to-day basis, and it interrupts what is referred to as self-referential thinking. We look down on ourselves on what we're doing today, and it's very easy for us to make a comparison to what we were doing 1 year ago and 5 years ago, and we can see how we've changed over that period of time, and we can extrapolate as to what might happen in our future. But those referential networks are actually broken down when you have a neurodegenerative illness causing damage to the brain, so that someone with a dementia can't see the changes in themselves.
Yes, I've heard of that. Yes. I found, Catherine, it's so Alzheimer's and other dementias, it just baffles me because sometimes you have people who know, like my husband knew, my mother-in-law knew that there was something that wasn't right. They might not wanted to have admitted, exactly what it was, but my mother-in-law would say, oh, I'm getting like my mother, because her mother had Alzheimer's, but it wasn't called it back in, the late 70s, early 80s. She wasn't given that term for her mom. We had a meeting where my husband worked. They had me in on his disability meeting because they knew he couldn't remember. And they told him all the things that he did. I said, Matt, do you remember any of that? And he was like, well, if you say I did that, he didn't remember. He didn't remember, or he didn't realize what he was doing, or a combination of both. It's fascinating.
It is fascinating. Mm-hmm. It's oftentimes a combination of those things. I think it's really important to understand that with the anosognosia present in most individuals, they may be able to see that there's something wrong. And when that's the case, those people are often very, very distressed, yet they can't then extrapolate and then plan what to do about it. So while in one sentence they may make, I have this terrible thing going on in my brain, then in the next sentence you say, I understand, and that's just awful. Let's see about adding some help in the home so that there's someone who can help you get out like you enjoy it. You might immediately get back, I don't need something like that. And so in the one sentence they're expressing they acknowledge something's wrong, but they can't do the high level thinking that we're doing to build on that and say, okay, then this needs to be done to shore things up or to make adjustments. And that's where they get stuck. So understanding that their brain's not capable of admitting or acknowledging what's going on, we can then strategize on how to implement plans in a different way, specifically you don't want to tell someone they need something because they can't see that they need anything whatsoever, even if they sense something's wrong. So you have to try and implement changes grounded in either something that you share or put it out there as something that you need and you're asking them to go along with it.
Yes, yes. And we have to live in their world. And as many new caregivers, and I've belonged to many caregiving support groups, people found that very difficult to live in their loved one's world. That, they are missing where the bathroom is. They don't know where the bathroom is anymore because that's their brain is not, functioning. And also, dealing with hallucinations. And I'll tell you, Catherine, and I say this a lot, and I'll continue saying it till I can't talk anymore. I know firsthand the difference of an educated caregiver makes in the life of their loved one who they're caring for. Because when my mother-in-law, you're talking in 2000, she was diagnosed with Alzheimer's. There wasn't much information 25 years ago. Even though I was in the medical field, I worked as a licensed practical nurse, I never heard the term Alzheimer's. I didn't know about sundowning. I didn't know about hallucinations, the paranoid, the whole package that goes with it. I didn't know, so I didn't handle her hallucinations correctly. Fast forward to being educated when Matt, my husband, was hallucinating, I knew how to handle it. And it makes such a big difference. And that is why I am all for education. And I'll tell you, your book, Navigating Memory Loss, Essential Questions and Answers on Alzheimer's and Dementia, is a must-read book. This is a book, folks, I'm telling you, you're welcome. Buy this book because chances are, unfortunately, you will know someone who is diagnosed or you will be diagnosed. What is it, 1 in every 3 people are diagnosed, like every 3 seconds, with some kind of dementia? You need to have
every 3 seconds worldwide, yeah.
Yeah. So that's a lot of people, folks. So this is an essential book to have in your library because it's just important. And you know what? I noticed this. I'm very observant when it comes to book covers. Excuse me. I like your book cover, Catherine, because to me it looks like the person on the cover is in a fog. It looks foggy. And aren't we in a fog when we're told, your loved one has Alzheimer's or whatever the diagnosis is? Your mind goes blank. And you do go in a fog. And it's like you're lost. What do I do first? Where do I go? And I hope it's improved. But, there was no guidance from the doctors because they didn't have the education back then. Right. Like they do now.
Well, and also I just got to the publisher, Rick, who we both know, final edits this morning, Betsy, because I put in the book a very small section with the newest updates that were released at the Alzheimer's Association International Conference just a little bit over a month ago. And that is an incredible conference where people present the newest data. And it's also wonderful because you have researchers from all around the world presenting their findings and communicating with all of the rest of us on what's going on behind the scenes. So at that meeting, there was a good amount of discussion about these new anti-amyloid treatments. And bottom line is the results in the real world, Betsy, look good. The results look very good, meaning that we finally have an illness that can slow the rate of decline, what we refer to as changing the trajectory. Someone is on a trajectory of illness, either going down or going up, and with a dementia, it has been universal. It is nothing but decline. For the last 20 years, we've only had medicines that treat symptoms, but we finally have a medicine that can change that slope or the trajectory. So that's wonderful news. So I've got that in the book. And those medicines, as they're used more and more, we'll find out more about them. It's possible that if we start them early enough, people might even have the chance to stay stable. And that is absolutely breakthrough. You know that as well as I do, having lived through this yourself with a loved one.
Yes, that is wonderful news. And hopefully these drugs, these medications will be available to people where they could afford them. That's another problem.
Right. Yeah, well, that's a big issue, but it's being attacked, so to speak, on different fronts. And one of the main ones is that one of the anti-amyloid medicines is going to be available as a subcutaneous injection, so people could give themselves a shot once a week at home. Betsy, we should say to people, what we're talking about here with these medicines, that these anti-amyloid treatments are almost like going in for a chemotherapy, where you have to go into an infusion center, and it has to be a place where they know how to give this medication to minimize the chance of any side effects. And they're expensive. They're quite expensive. They are covered by Medicare, though. So for people who have Medicare and a good secondary, they may only have a deductible to pay. So at least in the United States, they are relatively affordable for the folks who have Medicare as their primary insurance. It varies around the rest of the world. And starting next year, the medication lecanemab, once it's available as a subcutaneous injection, people can get at home. That's going to change things a lot, Betsy. So we're really moving forward. There were also other medications being talked about at the conference, repurposing of medications that we currently use to treat insomnia, repurposing of the medicine we use to treat type 2 diabetes and obesity. It looks like those might really help with a dementia. So we're going to have some pills that we can add pretty soon as well. We are finally making breakthroughs in this field.
Oh, hallelujah. That almost brings me to tears, Catherine, really. I so hope, for a cure for my son's generation, because my son is at very high risk for getting early onset. And I just hope, for a cure. It took, my husband was diagnosed in 2010, so that's 15 years ago already. But it took, caregivers speaking up, as you know. And, back when I started in my car to talk about Alzheimer's and caregiving, caregivers were not vocal about their journey. I'm glad that's changed. I'm glad you see caregivers on social media. The podcast world is almost saturated now with different types of podcasts for caregivers. So there's more information available. There's more resources available for caregivers than ever before. And I'm so grateful for that. I really am.
I agree with you 100%. Yes. Yeah. Well, and the other thing which I emphasize is in the book, Betsy, is how understanding that the person you love might have anosognosia, that can help you figure out a way to normalize getting in to see your doctor for screening. And also, with this new information that there are treatments, hopefully that will remove the stigma and fear, because we all want to get screened. We all want to get evaluated if we really think we're having problems, because there is treatment available.
Yes. Back 15 years ago, Catherine, my husband was only 56 when he started having problems at work. And I told his primary care doctor that Matt was having memory problems. And he blew me off. Like, he didn't believe me. Until the company doctor, and I don't know if the company doctor talked to him over the phone or she saw him in person. That I don't know. But she suspected Matt of having some kind of dementia. She was hoping it would be the reversible type, but she knew it had a feeling it wasn't going to be. And Catherine, she never saw his MRI. She never saw his EEG, which is abnormal. So is his MRI abnormal. And when Matt's primary care doctor got to know from his company doctor, he called me up and he said, "Betsy, what's going on?" And I said, "I told you." This was like in May. And I said, "I told you when Matt was in the hospital that December, he was having problems, but you didn't believe me." And, you know, his attitude was, well, there was nothing I could have done for him anyway. Eventually, his doctor did the screening, you know, with the clock, drawing the, you know, the lines. So, well, you know what it is, you're a neurologist. And I said to him one time, "Well, too bad you didn't have this when Matt was starting to have problems. Maybe you would have believed us." And he rolled his eyes and said, "Betsy, there's nothing I could have done anyway." I said, well, that might have been true, but you could have believed us. And that's what's frustrating.
Right. And
you know, not being believed. Yes.
Well, but it's now different, and now we really need to change the perception of all of the primary care docs out there. So one of the other things that was talked about at the international conference was a formal endorsement of a tool which is publicly available, which is called the AD8. Have you ever heard of that?
I don't think so. You can explain it, then maybe I've heard of it. I might not have heard it called that particular.
This one is one of my favorites. It's a really brief screening tool developed by Dr. James Galvin, who's developed a lot of tools for dementia care. And it's valid screening for mild cognitive impairment when you ask these questions to both the person as well as their companion. And it asks if there's been a change within the last several years caused by cognitive problems in either your judgment, your interest in hobbies, repetition of items, learning how to use a new tool, being oriented to the month or the year, handling complicated financial affairs, remembering appointments, or just with daily thinking. So there's 8 questions, hence the AD8. And if the answer is yes, there's been a change in those within the last several years, if you answer yes to just 2 of those, that is valid and as a suggestion of mild cognitive impairment, and someone should get evaluated. So that's the sort of thing that a concerned family member can fill out around their loved one, arrange an appointment with the primary caregiver, and bring it in and say, look, this is evidence. There is a problem. You need to do some investigating here. And it's important, as you mentioned, to look for those treatable things, because it can be a side effect from medications, it can be a problem with your thyroid gland, it can be a vitamin deficiency, it can be a sleep disorder. There's a lot of things that can cause confusion and muddled thinking during the day that are quite treatable. It's just now we can start to add Alzheimer's to that list of treatable conditions.
That is really wonderful news. Even as far back as 2020, my older brother was having memory problems. And my mom, she finally took him to a neurologist, but the attitude of the neurologist was, well, if it is Alzheimer's, there isn't much, to do about it. And my mom didn't want to believe that Bradley was having memory problems. And I told her, I said, listen, Bradley's friend called me up and told me his concerns. He was concerned about Bradley. I had recommended a clinical research place. My mom took him there, but he didn't qualify at that time. And unfortunately, my brother passed away. After Bradley passed away, then they called and said, oh, he qualifies. A little too late, unfortunately. Yeah. But, right. We know that it doesn't happen overnight, although sometimes it seems like it. But we know it doesn't happen overnight. Sometimes we just don't notice or don't want to notice the early signs. Could you give us some examples of early signs of when someone should be concerned? Because some people, they'll say, oh, I forgot where to put my keys. Should I be concerned? Or if I got this person's name or if I got a word. When should we be concerned about ourselves or our loved ones?
Well, there's a lot of things that we notice with aging because, unfortunately, some sad facts of life is after the age of 7, the number of nerve cells we have in our brain starts to decline after age 7. And then after our late 20s, all of the the work which has been done in our brains to develop those elegant network connections, the white matter tract systems and everything, that's very slowly starts to age. And so after the late 20s, our ability to multitask, to process information, and even our ability to learn new information and remember it starts on a gradual decline. So that forgetting where we left our keys, if we don't make it a habit to keep our keys in the same place, is something that can happen more frequently, and simply because we're aging, we notice it more and we put more emphasis on it. So misplacing items is something that can happen more frequently with aging, and implementing strategies like places where you keep specific things is just plain a good idea. More trouble coming up with names of people you see infrequently in conversation tends to happen more commonly. And after about 60 or so, we do start to have more trouble coming up with words. Our vocabulary expands throughout most of our life, but then that starts to decline a little bit, so we do a bit more word searching. Those things do all happen more frequently, unfortunately, with aging. But if it starts to interfere at all with your daily routines, or other people share with you that they're noticing it, that's an alarm sign.
That's good to know. I have noticed since being in my 60s, I'm 67, I can't multitask like I did when I was younger. I guess now I just have to concentrate on one task at a time. But, when I was younger, I used to, do laundry, do bills, watch TV. And now if I do bills, that's it. I just have to do bills and concentrate on that. And I heard that multitasking isn't good for your brain anyway. It's better to do one task at a time.
I think you're going to get different opinions on whether or not multitasking is good for your brain. You and I are the same age, Betsy, and I can't multitask like I used to either.
Thank you, Catherine. I have to tell you, Catherine, in your book on page 18, how I wish I had your book 15 years ago. And you show X-rays, MRI of the brain in the white, because Matt had white spots on his brain, multiple, and a global shrinkage at the age of 56. And if I had your book to explain this to me 15 years ago, that would have been so much better for me. And this is why I thank people like you, Catherine, for writing a book so someone can understand. Maybe their loved one went for a CAT scan or MRI. And, sometimes the doctors, for no fault of their own, they only have 15 minutes, they can't explain everything thoroughly. If they had your book, they can understand more. And when I was looking at your book, and I was thinking, you know what, if I would have had this book 15 years ago, that sure would have helped me. And that's one passion. I mean, that's why I'm passionate about my show, because I want people to have resources that weren't available to me in my caregiving that are available now, because I want people to have a better quality of life, a better caregiving journey than what I had. And your book is so, I believe, would be very helpful for anyone, really, to have. Your book covers a multitude of different topics. And you're welcome. I hope it becomes a bestseller.
Well,
I'm putting it out there, Catherine.
I touch on some tough topics in here, Betsy. You told me you've already done podcasts around end of life, and I've got some very frank discussion in here about end of life, and most everybody I've shared with this with is extremely grateful for it. I have had one or two who thought I was speaking a little too frankly. However, I think we need frank discussions about if we become impaired, because even though there is treatment, we can still get impaired. And right now our treatment really slows it down. We could still end up impaired. And I think it's really important to be as open as possible that if we were impaired and living in a state where we no longer had control of our own lives, would we want our loved ones to put us through medical tests and treatment to prolong our life, or would we ask them instead to prioritize comfort care? So that's a big question.
Oh, absolutely. Yes. Catherine, I'm so glad you brought that up, because anyone who listens to me knows that I am very proactive. The best gift you could give your family is to have your living will, your medical directives done. Make your wishes known way before you get diagnosed with any kind of illness. I believe at the age of 18, when children go off, your young adults go off to college, they should have a medical directive, because in the United States, 18, you're an adult, and if, God forbid, something happens to your child in college, you don't have a right to know about it, even though you're their parent. It could always be changed. Wills, medical directives, they can be changed, but to know what your wishes are so your family doesn't argue about it, that is important. What do you want your end of life to look like? I'm so glad you brought that up.
Yeah.
Exactly.
I consider it. I always say to people that we write our own life story, and I consider the end of life the last chapter. And we need to put an outline there so that our loved ones and families don't end up filling in blank pages with what they think we might want. And again, as you did, I went through this personally. And for the last year, at least, of my mother's life, she was confined to a wheelchair. She didn't recognize any of us. They had asked me about putting in a feeding tube, and this was 20 years ago. We had no guidance on this back then, zero zip. I said no, and I don't think she would have wanted to even be existing like that. So I have basically, written a letter, which is an addendum to an advanced healthcare directive specific for neurocognitive impairment that states if I do have cognitive impairment, as I mentioned previously, I don't want my infections treated with antibiotics. I want pain medicines. Don't ever force or coax me to eat. Don't give me any medical tests. Try to get me into hospice care. All of those things, because a standard healthcare directive generally doesn't cover this kind of a condition where someone is impaired. And for all of us, when we see someone becoming impaired, it's just our natural nurturing trait that wants us to keep them safe and to keep them, quote unquote, healthy. So it's very common to encourage them to eat, get them high-calorie supplements, not let them go out, prevent them from having any kind of falls and such, rather than considering, well, perhaps they're not eating because their brain's forgetting to eat, or it's not recognizing hunger, and that's part of a natural shutting down process, and maybe we shouldn't derail that.
I'm so glad you brought that up, Catherine. I am so grateful now that there are hospice nurses and social media who are talking about end of life, what to expect at end of life, and the process of end of life. How I wish that was available to me. And even though I worked as a nurse, I didn't really realize the process of dying because I wasn't taught it. And I didn't know that your body didn't need food or liquids when you're dying. And it's so cultural that when someone's sick, you want to feed them, right? You want to give them food. I think that's just our nature. But they don't need food. And that would cause them more of a painful death. So I'm so glad for people that, again, grateful to you, Catherine, for writing your book that explains this. And it is important. As soon as Matt was diagnosed, we went to a lawyer. And I had Matt do his living will. And he didn't want a feeding tube. I didn't want to make that decision. He made it. And Matt lost a lot of weight his last year of life, a lot of weight. And he was eating. He was eating very well, but he was losing weight because of the nature of the beast. And the doctor said to me, do you want to consider a feeding tube? And I said, why? No. Why would I put Matt through that? Prolonged his suffering? And people might get mad at me and say, oh, Betsy, people with Alzheimer's, they don't suffer. Well, you know what? I saw my husband suffer, so in my case, in my situation, my husband did suffer. And it's just, I would not put him through that. And even when that was mid-stage and he was treated for internal hemorrhoids, the gastro doctor wanted to do a colonoscopy, which I knew he would to rule out cancer. And I said, no, I'm not putting that through that. He couldn't tolerate.
That's tough.
He goes, well, he said, I have to laugh. I have a sick sense of humor. He said, well, You can give him a couple of enemas and he can run to the bathroom. I said, you don't get it. Matt doesn't run. He shuffles. He could not handle the prep. I am not putting him through that.
Right.
So,
and
that was my decision.
It's a very tough conversation, Betsy. Also in my book, I've got a small section talking about when I had the opportunity to do an immersion experience at the Hoekevak, which is the dementia care community in the Netherlands. And they have a very different culture over in the Netherlands. And they tend to follow more of a social model. In the United States, we're highly connected with the medical model. We're very trained as physicians and as a society to look for what the problem is, to give a diagnosis, and then a treatment. And someone can become cognitively impaired while the doctors are still putting them through all kinds of tests and treatment. At the Hoekevek, they're looking at people's overall quality of life, and they prioritize autonomy greatly. So the people who are admitted to that dementia community have moderate to severe dementia, and it's laid out as an open community. There are small homes in there, and they put people together in homes based on their cultural preferences. Luckily for them in the Netherlands, they don't prioritize politics like we do in the United States. It would be harder in the United States. Over there, they're more culturally based, which is nice. And the people are free to wander all around the community. And they do just that. The staff at the Hoekevik notice that residents become more physically able once they get there because of the fact they're allowed to wander. When they get there initially, they oftentimes go into the wrong house, and the staff just directs them to the right house, and eventually they figure out where they're supposed to go. And it was stunning as we were walking through that community. There's trip hazards. There's fountains. And when we asked the staff about that, they would just kind of look at us and say, things happen. And interestingly enough, over at the Hoekevik and in the Netherlands, when things happen, even if someone takes a fall, unless they've got a broken bone or they're bleeding, their number one treatment is observation. So it's a whole different culture. And I talk about it so that we can all try and think about that and bring it into the conversation when you're dealing with a medical team that is very deeply set in the medical perspective.
Yes, I have heard, I've seen that, where they had like the villages and it's like back in time. They had the old time stores and yes, I wish they did have that around here. I just interviewed a doctor last week who was medical director for the PACE program in, I think it was, but it's in California. I'm not sure, San Francisco or farther down south, but it's having social connection, being socially active, and music. Music and music therapy for those with dementia is just wonderful, and being social.
Absolutely agree.
It's so important. People think, well, why should I visit them? They don't know who I am. They recognize your voice. I truly believe that. And I always say this, I learned this firsthand. Dementia may rob the brain, but dementia does not rob the heart of love. I have said that for years, and I truly believe that because, as you know, because you're a doctor, Catherine, hearing is the last sense to go. I believe God created it that way so we could hear our loved ones talk to us, and they know your voice. They feel your love. Make no mistake about it. They know it. They feel it.
That emotional connection is the very last to go. The reason people oftentimes don't want to visit Betsy is because it's so painful to them.
Yes.
It's painful.
Yeah.
You know, I would drag my husband and our 3 young daughters to visit my mother. I hated doing it, and boy, they were young. They hated it too. You know, because you don't want to see someone you love like that. You really don't. But hopefully we're modifying our strategies, our understandings, and we've got new treatments, so this is going to evolve in a better direction going forward.
Yes, and I think, because I used to take my son to visit his grandfather. My dad also had dementia, and his great-grandma. And I think we could teach our children, grandchildren, such valuable life lessons by visiting their relatives in a facility, even if they do have a memory problem. They love to see young people. And, there's so much to learn, from our elders. And I just, Alzheimer's, I say that Alzheimer's took, Matt away, but Alzheimer's also was sort of like a gift to me because I found my voice and I'm using it to help other people.
There you
and
go.
I found my strength.
I love that, Betsy. I love that.
And
that's great.
Thank you. And, we have a choice. I say this a lot, too. You can be bitter because you went through this journey or you're going through it. Or you can turn it into, well, I'm a better person. And, you could find your purpose if you want. And I tell people, while you're caregiving, have your, live in the present time, but have your eye on the future because your caregiving journey will end at some point. And what are you going to do? And that might be, sad to think about, folks, but it's a fact of life. And, what are you going to do with yourself? Because a lot of times, and I've felt this too, okay, well, who am I now and what am I going to do? And that's an issue of, after the caregiving journey. But I just think that, and I am really grateful that there are resources out there to help us, to help those caregiving now. And, Catherine, I might sound like a broken record. I don't care. I'm going to keep repeating it. Your book is a wonderful resource. Folks, I'll tell you, to me, I don't know, I'm a Jersey girl. I say it like it is. I'm my father's daughter. This book, I call it, buy it. It's a no-brainer. You're having a doctor, an experienced neurologist who is also a caregiver that wrote a book. How much, I don't know. This is, to me, a win-win. Both sides of the fence you were on. I would be jumping October 14th to buy it because it is. I feel that strongly about it. I looked at the book. Catherine was sent me a PDF. I have a hard time reading PDF for my book, so I did what I did look it over. My opinion, it's excellent. An excellent book to have.
It's also super short, Betsy. It's like
it is
no more than 80 pages, and I did that because I think we all have a diminished attention span, and so I just tried to get to the high points.
You know what, Catherine? That's a point. That's two great points. It is short, but it's powerful. It's informative. It does keep your interest, and you bring out important points and information for people to know. A matter of fact, I think your book should be in every primary or a neurologist office. I really do. Every doctor's library.
Well, Betsy, how about this? I'm going to ask that all of your listeners help make other people be the changing force to help doctors understand there is something we can do. We need to get screened. We need to get treatment when appropriate. And I think maybe rather than trying to educate the doctors here, we'll educate the population and have it go the other way around. How's that?
Absolutely. Absolutely. I just told I just went to cardiologist last month, and I told him I just interviewed a couple who wrote the ARP, the Caregiver Answer book, and I said, you should tell your patients about this book. Well, now I'm going to show your book to my neurologist because I have an appointment in a couple of weeks, and I'm going to tell him about both of those books because it is important for, doctors to guide. I mean, I know, well, now it's changing. My neurologist, his wife works for Copsa, New Jersey. She's a geriatric psychiatrist. And he told me, and this is a couple of years ago, he said, Betsy, it's changing. They're caring now for the caregiver. And they have meetings. And that thrills my heart. That warms my heart, Catherine. Because for so long we weren't heard. We weren't listened to. But it takes people like you, like me, like thousands of other caregivers that are saying, hey, you need to listen to us. Help us, guide us, give us direction when we hear that diagnosis. And that's just how I feel. So I just want to thank you, Dr. Catherine, and that's Catherine with the C, folks, Madison, for coming on today, for writing your book that will be published October 14th. And I just want to thank you for all that you do to help people, caregivers and their families.
Right back at you, Betsy. You're doing a ton yourself.
Oh, thank you so much. Where can people purchase your book when it comes out?
Well, it's going to be available at just the usual places online like Amazon, but then I'm also going to have it available through my website, which is mdmemorycare.com.
Awesome. And people can connect with you on your website, Catherine?
Yes, they can.
That's great, folks. Take it from someone who has experienced their loved ones with dementia 3 times, 4 if you want to count my brother, but he wasn't diagnosed before he died. And it is so important to have education, to educate yourself, so you can be an advocate. You've heard me say this over and over again. I'm going to continue to say it until I can't speak anymore. I believe in educating yourself about your loved one's diagnosis, your own. If you're diagnosed with an illness, to know about it. You need to know how to advocate for yourself and your loved ones. And it's the squeaky wheel that gets the grease. But I just, I want to thank you again. You heard Dr. Catherine Madison. You heard Dr. Catherine Madison today. Her wonderful book, soon to be published October 14th, Navigating Memory Loss, Essential Questions and Answers on Alzheimer's and Dementia. Can't thank you enough, really.
Thank you.
And all
Betsy.
the information, you're welcome, my pleasure. All the information about Dr. Catherine Madison and the book will be in the blog that Jeannie White, who is the station manager, writes and produces the show. And I want to thank Lillian Caldwell, who's CEO of Passion World Talk Radio, who makes this all possible. And I want to thank you, the listeners, and those who subscribe. Please share the show. I want to help as many people as possible. Dr. Catherine Madison is an excellent resource. You can't get any better than an experienced neurologist who herself was a caregiver. Please share this show to help other people. And that's my goal, is to help people. That's why I'm here. And I want to share resources that can help you have a better caregiving journey and a better quality of life for yourself and your loved one. And you can follow me on Facebook, Betsy E. Wurzel, W-U-R-Z-E-L. And you can, it's free to subscribe to Chatting with Betsy on Spotify, Spreaker, Amazon Music. If you have Alexa, you can program Alexa for Chatting with Betsy. And I thank you for listening. Really appreciate it. And as I always say at the end of my show, in a world where you can be anything, please be kind and shine your light bright, because we need it now more than ever before. This is Betsy Wurzel, your host of Chatting with Betsy on Passionate Rural Talk Radio Network, a subsidiary of Global Media Network, LLC. Bye-bye now.